still looking at technology, there is an appetite within the UK and much further afield to support young innovators, early stage businesses who have ideas to create technology that will support an aging population. The key is to find the right kind of environments to prove and scale these ideas. And in that regard, what we've got now are 3 projects where SMEs with innovative ideas have joined forces with local government and are implementing projects. Now, I know about these projects because I'm also an Innovate UK monitoring officer, and these 3 projects are being funded by Innovate UK, and I'm monitoring them. So I'm pulling together my own interests and resources on this, because I think these are fascinating projects of which completely complement what it is that we're talking about today. So without further ado, I'm going to start off by introducing Julie Harrison, who's the commissioning manager for adult social care for Birmingham City Council, and Dan Stepney, who's the co-founder of Red Gear Solutions.
Hi Ian, hi everyone. Thank you very much for inviting us on today. It's great to be part of the conversation. Julie, are you there?
Yeah, I'm here. I'm just trying to show my face for you. I'm not used to Zoom. We do everything by Teams. It's always the way, isn't it? Bear with. I'm going to get there in a second. Get on.
If we could have the next slide in the meantime, that would be great, Nelly. Thank you.
Okay, I'll start.
What are you looking for? Your camera?
It's all right, I've got it, but I keep getting more coming apart over it, so I can't get it to click on. Sorry, Ian. And I'm just conscious of time, and I don't want to run out. So, what I wanted to talk today about is the work that Dan and I are doing around adult social care. We've got a programme running around technology-enabled care in Birmingham called Enabling People to Live the Best Life They Can. And it's all about using technology for the right people in the right ways. So if we can go to the next slide, please. So what I wanted to go through very briefly is the local context, what our aims and ambitions are from management team all the way through to my team. Tech, where we're starting and where we need to get to, because it's changing really quickly. The value of collaboration with people like Dan, and then handing over to Dan so he can talk you through about Red Gear and what we're doing, and then back to me briefly about what success would look like for us, and then what it would look like for social work as well, and then how it would fit with the ISOs. So next slide, please. So Birmingham is a super diverse city, as I'm sure everybody knows. We're one of the youngest cities in the UK, but we have got an ageing population as well. We have a huge AME population too, a lot bigger than the norm, but we've also got a very ageing population, and that continues to increase. So we've got lots of people that we need to see and look after through adult social care. Next slide, please. We've also got quite a few younger adults with learning disabilities, and those packages of care are quite high. And when we talk to younger adults, what they say is they would like to use technology a little bit more, so that they could, I mean, they're used to using smart devices, so they could live a little bit more independently away from their family. But picking up on the last point about carers, is that carers do need some reassurance that that person, if they're living on their own, is okay living on their own, and that everything around them is good, i.e. environment, and that they're moving around rather than phoning them numerous times, which a lot of carers will tell you. And during COVID as well, what has happened is, because a lot of our services like day centres have unfortunately had to close, We have now carers overload, so we need to help them with technology, which it's interesting, our younger adults are starting to go online and online activities a lot more, so you're almost pushing on an open door, which is really, really good. So next slide, please. So this is briefly, and this is, if you look at most local authorities' ambitions around technology-enabled care, you'll get these three coming time and time again. Enhancing independence and dignity, so there's personal choice in there, reducing isolation that we've seen through the last year in bucket loads, and supporting carers, as I've just mentioned to you. There's thousands of carers identified, or informal carers out there, and we do need to support them as best we can. Next slide, please. This is my favourite slide because it's a visual and I'm very visual, but what I'm trying to depict for you here is that technology-enabled care is moving rapidly, and local authority and people out there as well are confused, overwhelmed as to which bits of technology to use and how to use it and when to use it. So the top two quadrants, what that's telling you is that these are the items that local authority currently deploy. So community loan equipment, hoists, profile beds, getting people out of hospital quickly and being able to get home, which is great, and we'll continue to deploy them because they're really useful. And then, you know, on the other side, so the right-hand side, is currently the telecares of this world and the simple things. Not to say that simple isn't good, because it sometimes is, but where we need and want to get into is the bottom two, so the robotics, the cobotics, the virtual reality. Telford and Wrekin are just designing a virtual reality tech house. So you'll go onto hotspots if you get to the bottom of the stairs, and then what would help you with falls and things like that. Because whenever I speak to citizens in our workshops, we have quite frequently, they don't know what's on the market. Equally, social workers don't know what's on the market. So it's trying to bring the two together and getting them to run really well. On the other side, you've got the Internet of Things. And I think listening to you guys talking today and about housing, is that what we find is that we have to go and put monitors into people's houses, where Castlebrook in Kenilworth, one of the care homes, has actually built things into the wall that you can actually deploy or not deploy, as the case may be, for activity monitoring, which I thought was pretty radical. So you don't have to keep adding things into people's homes. You can literally switch a button on that room and that person gets activity monitoring. So shouldn't we be thinking like that in people's homes and connectivity? Just a challenge out there. Next slide, please. So the benefits of working collaboratively on technology-enabled care is obviously we can get close to people like Dan and look at their products. And we are working with Red Gear at the moment and just doing a compare and contrast with other things and working with citizens. So Red Gear's in people's homes and giving us information back, which is really, really helpful. And I think what helps, obviously, people like Dan is that we can share what we're looking for, what the citizens looking for and the families, and also share it with social care teams. So they get to see the information that they want to see to be able to do a personalised care plan, which is really, really important. And what we found with systems like Red Gear is they can reduce care plans significantly. I mean, we've had night waking care plans decrease by £65,000 a year, or they can increase it because that person needs more care. I've just put a little caveat on that slide just to say that obviously we don't have lots of time to develop stuff with providers, but it does beg the question, you get a more personalised service if you do. And I think the next slide is over to Dan.
Yeah, thanks, Julie. So I'm going to touch briefly on kind of the work that we have been doing with Birmingham City Council, what the challenge was, the solution we came up with, and how that's kind of all been implemented. Oh, sorry, back to that previous slide. Yeah, so three main points on the challenge. We needed to come up with something that would provide independent information to support personalised care plans. Because carers are rushed off their feet, they have to move around to have a whole number of residents in their kind of scope of care, and they can't necessarily assess accurately all those needs just with a short 15-minute care call. So we needed a solution that would kind of be their eyes and ears on the ground without being intrusive, to give them the information they needed to optimize the care they're providing. We also needed to provide information to not only the carers, but also a wider community of people who are interested, stakeholders, such as health professionals and obviously the family members as well. And during COVID times as well, another key benefit was something that was really easy to install and potentially could be installed by the residents themselves to save on the transmission of viral infection. Next slide, please. So what we came up with is what we call IGS Care. You can see the multi-sensor device that makes up kind of the first aspect of the solution. It measures 11 variables, which are sound, motion, temperature, light, humidity, CO2, atmospheric pressure, volatile organic compounds, the orientation of the device, so whether it's facing southwards, northwards, it's fallen over, the battery of the device, and also the black button you can see on the front can be programmed to give any message. In this case, in the care setting, it's usually either I'm up, I'm moving around okay, I don't need a visit today, or the exact opposite of that, I need some help, please pop in and see me. And what this allows us to do is understand how people are living within the spaces that they're living within, and how those spaces work, or as we see in a lot of cases, don't work for that specific person. So not throwing a blanket over people who live with dementia or people who live with respiratory tract issues, but understanding their individual circumstance. How is the building, how is the home that they're living in working toward them? And quite often we see things like very poor air quality levels, or a mix of poor air quality, low temperatures and high humidity are really not conducive of clean and healthy living for those people. The solution itself is totally mobile, it's battery powered, and it doesn't need any Wi-Fi or cabling connection at all. So it's a really easy, quick install. It can be done in a number of minutes. And it just gives us that detailed insight into how people are using spaces and how those spaces are working for other people. Next slide, please. All of the data that's collected through the multi-sensor devices comes into our platform. Robin touched on this just a few minutes ago, but the data has to go somewhere. For us, we work to this formula. Data plus action equals value. If there's no value in the data they're collecting, then it's a kind of a pointless exercise. So we work really closely alongside organisations like Birmingham City Council to understand how they use data, how that fits into their processes and solutions, and how they need to receive that data in order for them to act on it most efficiently and immediately, so that ultimately we get the best care outcomes for people in receipt of care. We do this in a number of ways. The first one you can see there is kind of dashboards. You can see a screenshot of some dashboards there. But more immediately than that, we can provide carers with daily reports about everything that happened over the last 24 hours or so. And even more immediately than that, we have alerts to point out if anything out of the ordinary occurs. For example, if there's no movement in the bedroom between 7 o'clock and 9 o'clock in the morning, when usually the resident will be up and moving around, we can let people know. If there is high VOCs, for example, we saw a fire in an apartment the other day, and we saw the effect that had on the air quality and the ongoing effect it had on the air quality for the rest of the day. We can point those things out and make sure interventions are in place to optimise the care. Back to Julie.
Thank you. Thanks, Dan. So this is a quick visual again, because I love visuals, about what we're trying to do with adult social care, and share it with children's as well, is move away from residential care, home care, domiciliary day centre into a more light touch, where we're giving personal choice with technologies. Not all families will want technologies, not all people want technologies, and we acknowledge that. But equally, where people do, and they want to say to the home care provider, look, I'd rather have 2 visits a day than 4, and I've got my daughter around today, so please don't come at lunchtime. We should have the flexibility to do things like that. So the Technology Enabled Care Programme will aim to look at how we develop and move from a more traditional approach to a lighter touch, with some home care, but with some technology. So we're really adding different things and different concepts for different people, which I think is really exciting and adds independence for people, which is at the end of the day what we want to do, and we know that people want to do it. And as age groups change, they're so much more au fait with technology. It'll probably become the norm, as at the moment we are trying to work through digital exclusion and isolation as well. So just wanted to share that one with you. And then the last slide from, well, the last but one from me, yeah, thank you, is what tech looks like. We have done a recent business case around technology-enabled care and shared it with management team. I've not shown all of the outcomes that we'd like to achieve from it, but some of the key ones I think we should do is that citizens should be able to live independently at their home. I think you've mentioned it so many times, home is best at the end of the day. That's where people are comfortable, that people are happy to receive tech. I hear time and time again from our people and our groups that we work with and co-produce tech and things like that, is please don't deploy it to us, talk to us about what it can do and how it can improve my life. Don't just send a box out and expect me to use it, so which is absolutely fundamental, but also to have that conversation with our social care workers as well as to what that tech can do, so they understand what is being deployed and why, and what outcomes we're trying to achieve for that person. Is it falls? Is it dementia? What is it we're trying to address, and be clear about it? And also, so can we identify the benefits of deploying tech? Obviously, hospital discharge is so important at the moment. We've started deploying an emergency mobile phone to our hospital discharge teams that they literally give to the person as they're leaving hospital, and it connects them to the 24/7 telecare contact centre care line that we use, which is going really well. Reduce hospital admissions, and obviously help carers, families and social care practitioners to understand tech and give reassurance to carers that that person's living home and living the best way that they possibly can. That's me, thank you. Oh no, one more slide on the ISA quickly. I think this is going to help best practice. I think homes, adult social care, children's social care need to work together. I'm already challenging our housing about, well, how do we make sure that we adapt to support people's lives with adult social care, and getting some very interesting conversations coming back. So I shall leave it there. Thank you very much.
Thank you very much. Fascinating, really in depth in terms of A, what you're doing, and B, what the solutions are. We're going to run on to the next two presentations, and depending on where we end up, take a couple of questions thereafter, if you don't mind. So without further ado, we turn to Sunderland, where we have Dave Young and from the city, and then Keith Chesil, who's from Solcom Solutions, which is the small business that is currently being supported by Innovate UK to evolve this project. So over to you guys.
Hi, as I said, my name's Dave Young from the City of Sunderland Local Authority, and I'm joined today by Keith Chesil from Solcom Limited. Today, between us, we're planning to give you a brief introduction of what we've been busy doing using consumer electronics and the Internet of Things to support the city's residents who have social care needs. A little bit like Julie, there's a lot in common with the previous demonstration that was just given. Our aim being to use technology to help those with care needs and their families to live independently in the community for as long as possible, which is a theme that we've heard today. This includes sharing with you the journey so far. So as well as connectivity, improvements are important to support assistive technology. So we've heard about the devices, but obviously connectivity is important. We're making some changes to meet our aim. We've learned that the connectivity is vitally important to developing our objective in using smart technology in care in the city as over a wide scale. Here are a few initiatives on this slide that we're currently undertaking to support that as a connected city towards becoming a smart city. So recently we've had a 5G pilot working for a little while. That's been successful, and we've actually getting further funding to extend and cover that in more locations. So it's providing that free ultra-fast Wi-Fi to people who maybe can't afford Wi-Fi or are out and about and want to connect to services. But for me, the most applicable new infrastructure that we're planning, and we should be here in March next year, will be to support local social care rollout and assistive technology is our low frequency wireless network system. So we want that because we know it will allow us to easily deploy these devices and connect IoT sensors anywhere across the Sunderland geographical area. Again, wireless connectivity is great, but we've also secured investment to upgrade the wired connectivity to boost internet speeds and capacity. So obviously, Sunderland is going to benefit from £62 million worth of investment over the next 3 years to help replace the city's legacy fibre connectivity. Next slide, please. Next slide. Sorry. As well as the connectivity improvements to support our assistive technology aims, we're also making changes to be able to deliver assistive technology at scale and altering how the way we work. This is the way we work. This includes the establishment of new teams to manage and deploy the assistive technology and hardware, and bringing together the provision of all smart care, telecare, telemedicine, and technology under one contract under our community living service. Our next steps are to develop a collaborative operations centre, accessed virtually by the city service providers, to ensure that we can make the most of the data that's being gathered by these devices. And we hope that it'll be more efficient and help us to make the best use of our public resources. Next slide, please. To the right of this slide, you can see a geographical representation of how that smart city thinking links to what we're doing locally with assistive technology, and what I've been explaining obviously in my previous slides. As part of that local perspective, we've already provided 550 households with consumer technology to be used as assistive technology. We've developed an improved software, including an item of software called the Social Health Enabling Independent Living app, as we call it, Sheila. And again, that's to support people to manage their social care needs linked to the devices in their homes. We plan to increase the provision of this assistive technology over the next 3 years, along with the improved connectivity, hardware and software that I've just mentioned. Given this, we think Sheila is suitable for deployment in different settings, including for people living alone or in supported living schemes or in multi-generational living. And we're about to test that out with software undergoing user acceptance in the next 2 to 3 weeks. Next slide, please. So why are we doing this? Well, the demand for social care in Sunderland is only going one way and fast. And at the same time, social care budgets have undergone drastic reductions over the last few years, and they're likely to continue well into the future. By making best use of this technology, we hope we can make our budgets go further, and at the same time change care monitoring to be more inclusive, to enable families and care professionals to access live data to help them in their care roles. That's where we see Sheila and Solcom come in. Keith, do you want to elaborate on how Sheila works for our audience?
Yes, please, Dave. Can we have the next slide, please? So here's a diagram of the system we're working with. So I'm Keith Chesler. I run Solcom Limited. We're an SME working with Sunderland City Council. And we've developed a central scalable resource, what we call our Wazan Digital Health Cloud Platform, where we can take health and social data. So in this joint development, we use a wide range of pre-existing smart home sensors, technology linked to the cloud in real time. We track a person's activity as they live their life in their home, so their movements, when they open doors, when they turn on appliances and so on. And this gives a picture of how well they're coping at the home, whether they're changing for the good or the bad. And through this system, a social worker can access a dashboard to look at that data and be given reports so that they can plan care services and support. The app that Dave talks, we call it Sheila. It enables family and friends to get involved in a person's support as it provides a remote view of what's happening. With the next slide, please. Sorry. The smart home sensors are low cost and easy to deploy. They're IoT and LoRaWAN. The LoRaWAN sensors provide the same sort of functionality as the IoT system. They're self-powered and they connect to an external radio network, so they don't need any infrastructure in the home. With this, LoRaWAN SOS button would work across the whole city, and it would also provide the user's location. During this project, we found that the lack of standards across the common smart home supplier brands has been a major problem because none of them work in the same way, and access to the data is always through their own cloud. We have found some suppliers using open standards, and that's been essential for the success of this project. Family and friends share the care load between themselves and the council with the app. The app gives them a real-time window into what's happening at home, and the app can create alerts for events such as a door opening at night, more time being spent in the bathroom, or a user leaving their normal travel zones. And then we've implemented some artificial intelligence to use pattern matching and analysis to identify changes in behaviour. And this provides diagnosis information to the social worker in the form of reports with indicators like the person's spending less time in the kitchen, so they may not be feeding themselves properly. The Wazan cloud that we're using already monitors the health of around 5,000 Sunderland residents. So these developments together provide a full picture of health and social care. Back to you, Dave.
I think you've got one more slide, Keith, haven't you?
Oh, sorry, Esther. The applications provide a framework for expansion of care services and health and social services. The smart home system provides user own protocol and system integration layers. And through this development, we've iterated to devices using standard protocols, selecting systems that can remain under our control, which is critically important at large scale. Data protection, security, legal and ethical considerations of monitoring and even controlling a person's environment are big challenges. To gain most in the future, technology needs to be standardized and interoperable. The social and legal implications of remote monitoring must be debated with guidance on who this facility can be applied. Sorry, Dave, back to you now.
Yeah, thanks, Keith. So what are we basing our project on to risk making such major changes in investment? Well, over our journey so far, we've reviewed the outcomes both of assistive technology benefits to the individual and to that of the Social Care Commission and their budgets. One of these IoT national testbed studies actually was deployed for 3 months with 75 individuals, and that told us a great deal when we evaluated that. And on the screen there, you can see some of the feedback that we've gotten. As well as that, the company that done the evaluation, the independent company that done the evaluation, gave us a business case, which we've been following to improve Sheila and also to invest in our assistive technology offering with the proviso that over 3 years that we'll implement it, we will be looking at £3.7 million worth of savings over 3 years to the council's budget coming back. And that's even allowing, we would have £4.7 million, but £1 million of that would be running costs over the 3 years. Next slide, please. So in addition to the findings of the testbed report, we've also been creating case studies to help us evaluate our assistive technology approach. And here's an example of a case study, so just so people can fully understand how this technology can save some money to the person and some money, sorry, to the commissioner, and is beneficial to the family. So Mrs. C lives in our own home with her son and our family. They live all together in one family house. Mrs. C's had dementia. She's supported by her son and our extended family to manage this. Mrs. C has decided that, or has started to wander on occasions due to her illness, but she reliably takes a handbag with her every time she goes out. But the family, though, have become increasingly concerned around Mrs. C's ability to continue to live with them independently, because they're worried about her wandering and leaving a door open or getting run over while she's out and about. So they were considering residential care and contacted the social services to speak to someone about their concerns. However, the family, when they spoke to the social worker, did prefer that, they wanted their mum to remain in their home with the family for as long as possible, and that's what Mrs. C wanted as well. So along with the social worker, our assistive technology team went and did a visit and decided that actually this was a good case for assistive technology to be deployed. So we deployed quite a cheap solution of assistive technology, including GPS tracker, door sensor, and the Sheila app that we were on about, which obviously the family were downloaded and put on their phone, which alerted the family to things like if the door went, and then obviously it had a built-in GPS tracker. So if the door did go and it was open for a certain while, people, the family could obviously, if they were worried, go in and collect Mrs. C from maybe, prevent her from any danger. The cost of the AT solution, as it happened, Mrs. C has probably already had broadband in, so it was quite small in terms of cost. It was about £450. That, the difference of that being the cost of a traditional solution, which would have been, residential care, which in the northeast is around about £665 per week. Now, Mrs. C, as it turns out, doesn't have the financial means to pay for that, so that would be the local authority and the commissioners that would pay for that. So it's about £34,500. Even so, the actual cost avoidance to the council, even allowing for that, just paying for the AT solution, if we manage to keep Mrs. C in our own home for longer, which we have done actually, it's a win-win. So the council maybe avoid a cost of just over £34,000. Mrs. C's family's happy, and also Mrs. C's happier. And that brings to my conclusion to an end. Next slide, please, and thanks. I'm happy to take any questions.
Thank you very much, Dave. We'll save the questions until the end, but I just want to say, I don't know if other people recognize the significance of what you're saying here, because the difficulty is putting a cost to some of these innovations, and the fact that you've been so generous in sharing this information could be absolutely invaluable. So thank you so much for that. I would encourage the audience to submit some questions while the next presentation is on, and then we'll pick a couple of them out for the conclusion. But we'll move straight on to our final presentation, and with this we have Mike Holden, who's project manager for the City of Wolverhampton Council, and Andy White, who's a VP of Solutions Engineering for PredictX. This is an interesting one because both organizations are partners in the project that's been funded by Innovate UK. So the council is also party to the monitoring process, and this really is an interesting project. So over to you, Mike.
Thanks, Ian. Good afternoon, everybody. Just want to talk briefly about our project, which is about creating a health and care data system to predict the future care pathways of our local population. And the main key aim is to support prevention and early intervention. And this will allow older people to live independently for longer. Next slide, please. So we've been working with Andy's company on a number of kind of projects around health and social care data since 2017. But the relationship between health and social care is often depicted as kind of being linear or sequential in nature. But when people become older, that relationship can become far more circular as they get more comorbidities and long-term conditions. Additionally, it's been very unusual for a local authority like ours to become actively involved in a data science project, especially to sustain it over a long period of time, which we had done, given obviously the financial constraints and capacity issues in local authorities. Basically, our innovation works based on the use of merged synonymized health and social care data, which is based on the NHS number, because we use it both in social care and the health service. And this kind of joining this data together is fairly fundamental, because it provides a holistic view of local health and social care data. And we can actually see individuals and cohorts of patients as they move through the system. So the data is actually incorporating hospital flow, which is A&E attendance, outpatients, inpatients, and discharges. And that includes all the activities, touch points, and costs. And alongside that, we've obviously got the social care assessments and the package of care that is the packages of care that are provided. We've also added into that, obviously, a lot of demographic information, and there's some information on deprivation, GP registration, and the actual providers who are actually providing the services. You can go on to the next slide, please. Thank you. So our approach has been setting up a significant collaboration partnership, and this has involved the City Council joining together with our local health partners and also the regional clinical support unit for the Midlands and Lancashire. And we've also got involved with the Black Country Sustainability and Transformation Partnership. The idea is that by bringing all these organisations together, we've formed a formal programme governance structure. So this is how we manage all our risks and issues and the key priorities. Now, central to extending the life of the project has been the fact that we've been able to demonstrate that we can predict with a high level of accuracy people's journeys through health and social care. And that's involved doing two proof of concepts. The first was whether we could actually predict when people attended A&E, whether they would be admitted as an inpatient. And secondly, following a period of time in hospital, whether we could predict what social care packages those people would go on to receive. Now, this has led to significant interest and some grant funding from the digital arm of NHS. And this is going to feed into the prevention early intervention service design that's ongoing in the council. Next slide, please. So the big issue about social care data is it actually is made very tiny in comparison to the wealth of health data we have. Now, if I could say that in A&E in November, 14,000 people attended A&E, and there were something like 3,500 admissions in 1 month. And we look at the fact that the population of Wolverhampton's almost 200,000. We only ever have about 3,500 people receiving social care. So what we're trying to do is to build on this to actually create a big data project. The mere fact is that the more data we have, the better predictive quality our algorithms will have. Now, this work has actually allowed us to develop people profiles and map across the city of Wolverhampton where there may be local hotspots. It's also allowed us to identify particular patterns of activity, and this allows us to look at particular groups of people, whether it covers a long-term condition, a specific ethnic group, or areas where we can actually involve the voluntary services and third sector. Now, we're going to continue to develop a big data project across the wider back country, because we believe that this is a very significant innovation, and we want to ensure that the work we're doing is relevant regionally and nationally. Next slide, please. And this is just a demonstration, the next slide, of how we map the profiles. So this is just a map of Wolverhampton, And these hotspots are based on lower super output areas, but we can plot these by council ward in relation to our primary care networks in the city of Wolverhampton, and actually by individual GP practice. Now, the lower super output area actually covers an average population of about 1,500 people, or 650.
Mike, you've gone silent. Maybe Andrew can pick up.
Yeah, we probably didn't have the segue quite planned at this point, but we can we can go from here. Hi everyone, my name's Andy. I work for PredictX, and as Mike mentioned when he started talking earlier, we've been working together for a number of years now. And what I'm going to talk a bit about is what we've been doing with Wolverhampton City Council and the funding from Innovate UK. And the piece that I maybe wanted just to touch upon, slides jumping all over the place. The piece that maybe I just want to touch upon first in relation to this project, because Mike talked quite extensively earlier about the goals that we've managed to achieve in regards to being able to connect together both health and social care, and then start to be able to predict what pathways individuals are going to follow across the different services. What we have been doing over the last 6 months is to look at how COVID-19 has started to impact that, and specifically the factor of where COVID-19 has had a specific impact and resultant changes of needs for individuals, and that can be both as a result of someone potentially being admitted to hospital with COVID-19 and the recovery from that, but it can also be in relation to the kind of the more preventative side of ensuring that individuals with service needs or with levels of need are isolated from infection as much as possible, and ensuring that the services delivered to those individuals are still aligned with the right pathway and the best pathway for that individual at that point in time, but ensuring that doesn't conflict with potentially a more challenging situation for the caregiver or for the individual in regards to the challenges around COVID-19. And one of the things that we wanted specifically to focus on in regards to this project was looking at how we could ensure that some of the specifics that we've talked about here were really sustainable. Next slide, please. And to do this, we specifically focused on the ASCOF framework. So this is an outcomes framework that exists within social care and links to a number of statutory returns that councils are producing nationally on an annual basis. And what we wanted to do was to start to link together both the strategic benefits that Mike had talked about earlier in being able to understand and predict these pathways, but also to bring in additional tactical benefits where we could to help facilitate not only the capture of some of this data that was needed to be done on at least on an annual basis anyway, but actually then start to be able to give Wolverhampton the ability to use that on a weekly and monthly basis to understand how those pathways were impacting the livelihoods of the individuals in the population that were in receipt of them. And what we specifically did here was we picked some of the indicators within the framework that focused on the the success in terms of once someone leaves hospital, how successful are the services in keeping that individual then at home, and with potentially with additional social care packages to support that, but out of hospital and at home for a sustained period of time. And that was really where we then started to bring in this early warning system to start to be able to identify where some of those pathways were indicating, and then potentially the KPIs were indicating that that the services either weren't necessarily doing what was hoped, or maybe the individuals weren't on necessarily the correct pathways to help facilitate that goal. Next slide, please. And one of the factors that we touched upon that we felt was really important here was that that tracking and understanding of basically of how successful those individuals were in staying at home and either being independent from a service provision standpoint, or independent at least in terms of them not having the need for continued healthcare and appearing at A&E or in hospital, was making sure that was not just a one-off exercise. As I touched upon, the importance we felt here was that ensuring that was a continually monitored set of KPIs and set of metrics, meant that could be not only looked at from an ongoing basis, but looked at from an continued improvement standpoint as well. So looking across both the commissioners, so the service commissioners of the care, as well as the service providers, understanding how that looks over time, and ensuring that any challenges or any concerns with that can be monitored, actioned against, and improved against, has led to stronger collaboration across the local area as well. And I think from an individual standpoint, is obviously leads to better outcomes for care recipients, but also a healthier and more independent population as a whole.
Bringing that to a roundup now, Andy.
That was me. Thank you very much.
Oh, right. Dave, you disappeared. I don't know if you lost your volume, but thank you very much. You've lost your mic. Thank you very much for that as well. I wanted to keep it tight because we've been running half an hour late, and we're running at that point now. I don't want to go any further over. Therefore, rather than a question, there's a statement, if you like, from Chelsea Renton, who talks about the fact that we moved from full circle coping with loneliness and isolation to by designing truly community-minded intergenerational neighborhoods that enable all to meet, greet, play, to something which is using monitoring and data to keep a digital eye on people. It's not about keeping a digital eye on people. In fact, it's the opposite. Each of these projects is working without cameras. They're digital sensors, and it's about enabling people who need to be in their homes to be more independent. But certainly the principle behind all three of these projects is to free people up. It's completely the other side of the same coin that we're talking about in terms of multi-generational environments. That's why we're calling them smart multi-generational environments. It is to empower people. So you need the design, you need the buildings, you need the public space that we've talked about, but equally you need to take advantage of technology and using open source. And each of these projects are being developed in a spirit of open innovation. So I think that you'll find that these developers and these local authorities would agree with you, Chelsea. It is important to maintain the principles of a truly community-minded intergenerational neighborhood where people will greet, play, and look after each other. So one thing doesn't rule out the other. So thank you very much, the three presentations, the three local authorities and the three SMEs. I know they're going to go on and do great things. They're working with great partners, and I've seen some of the KPIs that they've referred to. And it's great to see, as Paul Quinn pointed out, these are very compelling business cases, never mind the quality of life improvements, which is also being measured.